So if you could teach them that the addiction is what was keeping them alive, almost keeping them safe, then it's a little
Yeah.
bit of a easier pill to swallow. And then you could start to help them to bring out that depression and that anxiety so that it's more overt versus covert and get to the root cause.
Welcome to the Woman Worriers podcast. You worry, I worry, we all do. If you're paying attention to the world today, there's a lot for women to feel worried and anxious about. As we explore the worries with curiosity and compassion, we learn to live more authentically and unleash the warrior within, someone who is strong, capable, and resilient, come what may. It's time to stop battling against yourself and start using your powers to meet everyday challenges with energy, purpose, and bravery. Now here's your host, Elizabeth Cush.
Hi, and welcome back to the podcast. I'm your host, Elizabeth Cush. I'm a licensed clinical professional counselor here in Maryland with a budding coaching business where I help women reconnect with themselves to live a more authentic life. You can find out more about me at elizabethcush.com or progressioncounseling.com. So today we're talking to Adina Silvestri. She is also a podcaster and focuses her podcast on addictions and recovery. And I know that COVID and the pandemic and isolation have really exacerbated, increased, pulled to the forefront a whole lot of addiction issues. And I read the other day that overdose deaths are just skyrocketing. And it's concerning, it's worrisome, but to me, totally makes sense. This is a really hard, stressful, traumatic time. And when we're feeling traumatized, we turn to coping survival skills to help us get through. And for some of us, substances were the way we learned how to cope with trauma. And so if you're falling back into old patterns of behavior, if you're concerned about your own recovery, I hope this episode will help support you, but also know that you're not alone. You are not alone. This is a tough time and we're doing the best that we can. But if you need help, please, please, please reach out. Adina Silvestri has a doctorate in education, is a licensed professional counselor, a certified clinical hypnotherapist, and a certified brain spotter in Richmond, Virginia, and she works with children and families. She specializes in treating women with substance abuse issues and in helping children who have experienced trauma lead full, productive lives. Dr. Silvestri helps women with binge eating issues recover from shame and find hope and healing. Dr. Silvestri's clinical work includes providing supervision to counselors in training, and she is an innovative counselor educator. She teaches aspiring counselors the skills needed to become empathetic and creative. In addition to the clinical work and teaching, she is the host of Atheists in Recovery, a podcast which works to address the spiritual and scientific belief systems of people in long-term recovery. She writes for publications such as The Dr. Oz Show, American Counseling Association, the Richmond Family Magazine, and other recovery and wellness publications. In her spare time, she mentors students through Blue Sky Fund, and her hobbies include sailing, running, and learning Japanese. Adina is going to share with us the connection between trauma and substance use and addiction, as well as some of the resources to help you get the support you need if you are struggling in this very difficult time and need some support to move forward. She's also going to describe how hypnotherapy can really be an effective tool in helping heal trauma and support recovery. So let's get started. Here's my conversation with Adina. Hi, Adina, and welcome to the Woman Worriers podcast.
Hi, Elizabeth. I'm so happy to be here.
Oh, I'm really excited to have you on and really enjoyed our conversation on your podcast. So
Hmm.
it's really fun to be able to sort of share the love, have you here too. But for my listeners who don't know who you are, could you share a little bit about you and really what inspired you to really focus a lot of your work on addictions, but your podcast also on addictions?
Yeah. So I have a private practice in Richmond, Virginia, and I specialize in working with women with substance abuse and eating disorders. And I help them to eliminate shame to find hope and healing.
Mm,
Yeah. And I'm a certified hypnotherapist and a certified brain spotter. And I think today we'll be talking about the hypnotherapy piece.
mhm.
And I have a podcast called Atheists in Recovery. And I wanted this podcast to, and I know that we'll get into this, but to talk about, to sort of delineate the spiritual component with the practical component and help people heal from their recovery.
Mm. And for you, what really drew you to the addictions piece and eating disorders for women? I mean, I know both can be significant struggles for women, but what was it about those two things that really felt important to you to help women?
Hmm. Yeah, I think that, and I've said, and I've talked about this in other podcasts, but working in a locked psychiatric unit, I saw the same people in and out of the hospital over and over again. And it just didn't make sense to me that they were there. These are young women, and we couldn't really help them with 5 days of detox.
Mm.
That was nothing.
Yeah.
And so I suppose that became my obsession. It was to help these women, and there was so much shame, that
Mm.
they carried with them. Some of them were mothers. Of course, they were daughters, and it's bad
Yeah.
enough to have that label attached to you, but yeah. And so they carried
Mm.
around a lot of shame, and I don't think it's specific just to women.
Yeah. 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 I would think addictions and shame kind of
Yeah.
walk hand in hand.
They do walk hand in hand. They do walk hand in hand. So I don't really have a great reason as to why women were the focus of
Yeah.
my
Yeah.
practice, but it just seemed like those were the people that were coming in, and we could talk all about why the men aren't coming in,
Yeah. Yeah.
but that's sort of where I held the focus. Yeah.
Yeah, yeah. Well, and I would imagine part of some of the crisis work I did, we were partnered, the hospital that I worked was partnered with an outpatient and inpatient drug and alcohol rehab, substance use rehab facility. And I would facilitate a biweekly women's group around trauma, addiction, post traumatic stress disorder, just an educational group.
Mhm.
And I think when I began the group, there was a lot of aha moments for the women who were in the facility of like, oh, you mean that thing that happened to me when I was whatever, whether they were sexually assaulted or abused or just had some very difficult life experiences led to later turning to substances to manage. And that was fulfilling, but also frustrating work
Mhm.
because, as you said, oftentimes even the 2-week treatment or the 1 week was just not enough
Mhm.
to really sustain either a sober
Mhm.
life. Yeah. Hmm. So I know recovery can be really, really difficult and cause a lot of distress and family dysfunction and life stuff. So, what do you see as sort of the biggest challenge for people who are considering or are working on recovery?
Mhm. Yeah, well, I definitely see it as a familial disease. So, the more people that I could get involved in that person's recovery, the better. But the challenge, and for the most part, there's always one or two individuals that are supportive of the recovery effort.
Hmm.
But I think for the most part, the biggest challenge that I see, and the reason that I started the podcast was having most treatment centers and most hospitals say that AA is the only game in town.
Mm-hmm.
And that's how that's why a lot of people started to come to see me, was because I don't know how they said that it was my website. I don't think that was my website, Elizabeth, but that I wasn't preaching that I wasn't preaching AA, I guess, and the God thing, which is huge. I mean, because if you have a belief system that was grounded in Buddhism or atheism or any of the other isms,
Mm-hmm. Mm-hmm.
you're asking somebody to believe in something like their life depended on it. And for many of them, that's a complete turnoff. If God didn't help me when my parents got divorced, when my dad died, when, on and on and on, how is God going to help me now?
Yeah. Yeah. Well, I know that, I've had clients similarly that just the 12 step, that does not resonate for them, the whole spiritual component. And it has left them feeling like, well, what about me? What about, like, how do I get the help and support that I need?
Mm-hmm.
I know this is a little off track of what we were scheduled to talk about,
No.
but so what are the alternatives? I mean, I know there are other programs
Mm-hmm.
too that
Mm-hmm.
that offer support that are not spiritually
driven.
driven. Thank you.
Yeah.
Yes. So what else is out there?
So there is Women in Recovery. There is Atheists, Agnostics, and Free Thinkers. There is Smart Recovery.
Mm-hmm.
There is Recovery Dharma, and a bunch of others.
Yeah, because I feel like if you're not resonating with the treatment program, like it's not gonna work.
Mm-hmm.
It's gonna be difficult. And especially if there's shame there around you not following the rules.
Yeah. And I don't, I don't want people to think that I'm anti AA, because I want you to find what works for you. Right. Right.
Yeah.
And maybe it's a little AA today. Maybe it's a little smart tomorrow.
Mm-hmm.
I have a lot of guys that have sort of this individualized approach. And that's really what I try and preach, is find what works for you. You have
Mm-hmm.
this free will, like
right.
use it. Yeah.
Yeah. Yeah. Yeah. Right. Find the things that are going to support you the best that you can.
Yeah.
And so, like, our culture, our society, our whole sort of system of how we manage stress is so linked to alcohol and
Mm-hmm.
disconnecting from the stress. But two, I think that just our belief systems and like how we gather and how we are as a society
Mm-hmm.
really promotes substance use in so many ways,
Mm-hmm.
although like certain substances, not all of them.
Mm-hmm.
But how does that impact the clients that you're seeing, and how do you help them sort of untangle all that?
Yeah. Yeah, that's a good question. I feel like, and I'm going to switch between now to men for a little bit, because I think that they are the hardest to come to get treatment.
Mm-hmm.
And we could switch back to women. But
yeah. No, I like it all. Yeah.
But I think in our culture, the dominant message that you grew up with was that, you suck it up, you don't show weakness. And that's how you just deal with pain, and you don't show it. Or if you do show it, it's through anger, and it's through aggression, and it's through things that are going to hurt you. And addiction seems to be one of those things. So I read a study recently where a bunch of doctors got together. They interviewed a bunch of doctors over, it was a longitudinal study. I don't remember how many years, but the majority of the people that they were interviewing across gender lines, they would give women the diagnosis of depression or anxiety, and men would get this diagnosis of addiction. And so I thought, well, that's horrible. And, no wonder why people don't want to come to treatment. That you're going to give them this diagnosis of addiction. And then, that's, first of all, they're going to get help, which is shameful, right? Because that's not what's taught in our culture. And
Right.
now you're telling them that they have an addiction and they're at fault for it. So it's like this double shame.
Wow. Wow. Yeah.
Anyway, I should probably stop with my little rant, but it's a lot to take in for men. And so I think that, trying to separate, and maybe separate is even the wrong word, because I think addiction and depression occur as variants on the same disorder.
Hmm.
So if you could teach them that the addiction is what was keeping them alive, almost keeping them safe, then it's a little
Yeah.
bit of a easier pill to swallow. And then you could start to help them to bring out that depression and that anxiety so that it's more overt versus covert and get to the root cause.
Yeah. Yeah. I love the perspective of whatever your addictions are, like they are survival
Yeah.
tools. Like that to me, to be able to see that with compassion, within for yourself, but
Mhm.
for others too is so important.
Yeah.
So I know oftentimes just the little bit of work I've done with the women in rehab, there was so often trauma
Mhm.
in their histories. Do you find that to be true with the men? I know you do some men's groups. Does that resonate too in terms of male clients as well, that trauma is often underlying addiction?
Yeah. They wouldn't call it trauma for sure,
Mm,
because it's just something that you just dealt with. Oh well, my dad would hit me, but
mhm,
that's what he did. That's what happened,
mhm,
and that was acceptable. And and so then you're saying, well, so then, it was physical abuse towards you, so it's like just sort of like a little different perspective.
mm,
And so yeah, I do think that there is a high correlation of trauma and addiction for sure.
yeah. And so with I know that you're a trauma expert, but as well as, using brain spotting and hypnotherapy, like how do those modalities, whether it's brain spotting or hypnotherapy, did they help? How do they help with addiction? But also, is there some healing that can happen for the trauma piece with either of those modalities too?
Mhm. Yeah, definitely. I think that the hypnotherapy and the brain spotting, bypasses the thinking brain, the frontal lobe, and really gets to the subcortical cortex, which is where all of the memories are stored. And, that's where you want those connections to happen, is on that deeper level. You want to get to the root cause of
Hmm.
the suffering. And so I do think that with that focused attention and awareness, that you're able to have a bigger, and also for some people a quicker
Hmm.
healing process. Not all. I have to be careful because everyone's different,
Yeah.
but
Yeah,
yeah.
but the potential is there for a
Yes.
faster process.
Yes.
And so talk to us about like how you might use hypnotherapy with clients who are struggling with addiction and probably have a trauma history. Like where
Mhm.
would that come into? Because I think, I've had Dr. Liz on and she's talked about her hypnotherapy practice, but not as far as addiction so much. And so how do you see that as a useful tool, a useful skill for clients maybe to teach themselves? Like,
Mhm.
yeah, where do you see it in therapy?
Yeah, I love that both hypno and brain spotting these are tools that you can teach the client so that they don't need to come back to you. And so it's not a therapeutic forever sort of deal.
Mhm.
And so I have some clients that only will do hypnotherapy with me,
Hmm.
and they come from, all across the country just for
Mm.
hypnotherapy for addiction. So you don't have to, I don't test for hypnotizability.
Okay.
I just assume that, you're in trance all the day, all the time, right? Every single day.
Mm.
And so there's a willingness for you to be there, right? You want this healing, you want this. So I just assume that you're there, and you're present and ready to work. And so we put you into a trance, and we go back into your memories, your deepest memories, and we will look for this emotional bridge to connect the pain that you're having right now, the worst part of the pain, with an earlier memory,
Mm.
an identity forming memory. And then we
Mm-hmm.
go in and we change it so that your perspective is different. And then we also work a lot on your future self. And every time that we're in trance or that we're listening to a script, we are outlining what your future self looks like. And I think that's important too, because if you're always saying I'm an addict or I'm an alcoholic, then there's really not a lot of room to grow or to change, because that seems like a static characteristic, when you're saying that.
Yeah.
And so you're really, with the script, you're listening to who you are and who you want to become. And there's that. Hypnotherapy seems to develop this emotional congruence
Hmm.
between that and the early decisions.
Wow. And so you said that, so you go back to sort of a pain point
Yeah.
and then work on shifting perspective.
Mhm.
And I'm guessing that some people might hear that as like, I'm going to change it and pretend like it didn't happen,
Mhm.
but that's not
No.
really what you're doing.
No, I mean, every time you bring up a memory, you're changing it just a little bit anyway. And
Mm.
so when you're going back into these earlier memories, when you're doing these regressions, you are looking at it as a way of healing. How can I best heal this part of me that, for whatever reason, needed to behave in this way for survival? Like, so for example, Billy, who had the abusive father in a
Mhm.
poor neighborhood in a poor side of town, he never stood up to him, always backed down, tried to keep the peace in the family so that no other abuse would happen to anyone around him, but then always carried that shame and that pain with him, and then had this belief that I'm no good. I deserve to not be seen, so things like
Mm.
that would be really
Mhm.
important to go back and say, well, no, you needed this. This is what kept you alive.
Yeah. Yeah. So sort of reshaping your perception on how you see yourself, or so
Mhm.
see those parts of you that did what they had to do to get through.
Right. And that you're no longer little Billy. Yeah. I mean,
Right.
and
Right.
so
Right.
now how do we take that learning and understanding on an emotional level and on a cognitive level to move forward to
Mm,
who you want to be?
mm. Nice. So almost like going back and taking care of little Billy
Yeah,
and helping him feel more safe and secure in the world so adult Billy can move on with his life and take care of himself.
exactly.
Nice. So typically, I think, in our pre conversation email, you had said that usually it's men who come for hypnotherapy, if I'm right. Is that right?
Yeah, that is correct.
And I'm curious why, if you have some sense around
Hmm.
why that is, or just what you've heard from clients about what would draw men to hypnotherapy versus women.
That is a great question. And if you know the answer to it, I'd love to be informed. I mean,
Yeah.
I have a sort of a working hypothesis in that it could be that hypnotherapy is seen as not a talking therapy, and
Mhm.
that it's quick acting. It's you don't need that many sessions in order to see result. You can see results after one session. So maybe those two things.
Mhm. Sort of a more results
Yes.
oriented versus like deep dive exploration, even though both are both talk therapy and sounds like hypnotherapy too can be a pretty deep dive,
It
but
can
just in a
be. It can
yeah,
definitely be, but
yeah,
that's
yeah.
that's sort of
That
where
yeah,
I am.
that makes sense. That makes sense to me. It makes sense to me. So I want to address too. So, COVID times, which is we're still in, has really, from everything that I've read, as well as just watching friends, family, not so much myself, but people have really turned to alcohol, substances as a way to cope, or at least initially were. I've read that overdose deaths are rising, and that like this is scary to me. That and I recognize that this pandemic is a trauma for all of us, but for someone who maybe has slipped back or maybe who is struggling, women or men who are really working to bring themselves back to their more, grounded, safe feeling selves, like what would you offer to them?
Yeah, I think that right now this has been a really, really difficult time for individuals in recovery, especially ones that are new to recovery. And so I talk a
Yeah.
lot about this in the podcast. I feel like, you know, connection, even if it's through Zoom, is really important. I know that it might not seem like the same and it isn't, but at least you're seeing other humans and you're able to listen and you're able to connect and tell your story. And, those things are still really satisfying and
Yeah.
can really help with just not feeling so alone. And so, connection, connection, connection. And if you're struggling, you don't feel like you can't. That's a really long sentence to say. Ask for help. Just ask for help. And everyone is so willing to jump in. I mean, I think on Twitter, and I can't remember the handle off the top of my hand, but there is like this 911 kind of I think it's called Recovery Posse. And if you're struggling, you just send a tweet and you'll get like 30 to 50 responses and people asking for your number, and it's like a really cool thing. And
That's awesome.
so yeah,
Yeah. So there's support out
there
there, but
is.
know that you're not alone in this, that this is a really hard time to stay sober.
It's a really
Really.
hard time to stay sober. It is. And so know that there's no shame in the game
Yeah.
for asking for help. There really isn't.
Yeah. Yeah. Hmm. And for longer term, you've discussed some of the resources for women in recovery, agnostic, smart recovery. What's a first step for someone who maybe is saying, okay, it's time to do something different? And maybe this is the first time they're considering making a change.
Mm, yeah. I would say to tell someone that you trust that you're ready to make a change, and maybe work out a plan with them as your support system. Maybe they'll even go to a meeting. I think meetings are a great way to start, even if it's online right now. And
Yeah.
because then
Yeah.
you know that you're not alone, you know?
Yeah. Yes. Yes. I agree. Yeah. Support and knowing that there's others out there that are struggling too.
Hmm.
That are working through this. So, Adina, I just so appreciate your coming on the podcast and sharing your expertise and a little bit about you. How do people find you and your podcast?
Yeah. Well, thank you so much, Elizabeth, for asking me to be on. This has been so much fun.
Yeah.
You can go to my website and you can find the podcast there. It's atheistinrecovery.com, and you'll see the tab for the podcast on the homepage. Yeah.
Nice. And if there were people who wanted to work with you, you said that you work with people across the country as far as hypnotherapy. So
Mhm.
is that something that can be done? Doesn't have to be like a state by state connection, like therapy sometimes does, right? Licensing and stuff.
Right. Right. And so a lot of states do not require the hypnotherapist to be licensed in that state. And so
Yeah.
if you're not sure if your state's one of them, you could always just email me and we can start there.
Nice.
Yeah.
Awesome. All right. Well, thank you, Adina, again. And I look forward to exploring other avenues with you, maybe in a future conversation.
That sounds great. Thanks, Elizabeth.
Well, I hope you enjoyed my conversation with Adina. I think the perspective that trauma and mental health and addiction are all things that are very closely interwoven is really, really important in reducing the shaming and misconceptions about addictive issues and people who struggle with substance use. And this has just been a very difficult time for all of us, whether you have addiction issues or not. This has been a really hard time. And I think that to be understanding and supportive and compassionate towards those who may have turned to substances again or for the first time in order to cope. It's important to have some compassion and understanding for them. So if you are in need of more support, please know that all of Adina's contact information will be in the show notes, as well as the groups that she mentioned, along with the 12-step links too, so that if you need additional support, it is there for you. I hope you all will be kind and compassionate towards yourselves, towards those in your lives, maybe those who are struggling with addiction right now, and go forward into this week with love and compassion in your hearts. Ciao for now from this Woman Worrier.
Thanks for listening to today's episode of Woman Worriers podcast. The information in this podcast is not a substitute for seeking help from a licensed mental health professional. Music was written and performed by Adina Cush. If you'd like more information on this episode, you can find the show notes, the resources shared today, and links to the guest profiles at womanwarriors.com.